a physiological problem. It's a problem that occurs when your body temperature is higher than the normal set by your brain. Generally, it's between about 36.5 degrees Celsius to 37.5 degrees Celsius that your body temperature is going to be around that range. When someone is beyond that range, a person is said to have a fever. And sometimes you have a fever, or most often you have a fever because your body is reacting. It's a kind of reaction because of something that is inside of you that is not normally supposed to be there. So today I want to focus on the causes of these symptoms. I am Dr. Beckley, and I'm talking on behalf of Carriers Health, and we are looking today at 5 causes of fever. Feel hot in your body. You cannot say you have fever unless you have used the thermometer. Fever can either be a fever that comes in the day or in the night, or it starts in the day and then it stops and comes again in the night, or it starts in the day, goes throughout the day, or it starts and then it stops in the day, then it comes again 2-3 days after, or it has other symptoms that are associated to it. So it's important to know the type of fever that you have before you start seeking for attention. But it's important to know that number one cause of fever is the infectious cause. We all know about this one. It's almost always common to see people saying fever is equal to malaria. Fever is not equal to malaria, though it is a very common cause of fever in our context. I'm speaking from Cameroon, and in Cameroon, we are in an endemic zone where malaria is the most frequent infection that we can ever see. But it doesn't mean that it's not always malaria in our context. Yes. I would like to shock you that, for example, less than 5 years of age, the most common cause of fever worldwide, not just in Cameroon, worldwide, is acute respiratory tract infections in more than 50% of cases. And so when a child presents to you with a fever within that range, you don't just think of malaria. Yeah. There are 4 types of infections. We have viral infections, bacterial infections, parasitic infections, and fungal infections. All of this can cause a fever. Fever is just, your body is just responding to a germ that is inside of you. And that germ can be a virus, it can be bacteria, it can be a parasite or a protozoa or whatever. It can be a fungal agent. Anything that is abnormal in your blood will cause a fever. You see. Number 2 reason why you have a fever is because of a tumor in your body, usually a cancer in your body. So sometimes remittent fevers that don't easily stop is one of the signs for you to check further if there is something else apart from an infection, especially if you have been treating an infection, you have been giving drugs here and there, it's not going. Please go and check. Let's be sure that there is no tumor or cancer somewhere in the body that is producing the fever that you have. Yes, you should take note of that. The third cause of a fever is inflammation, and inflammation can lead to a fever. You can hit your hand somewhere and then you feel like the place is hot. Already, the way you touch the place, you can feel like it's hot. So when there's an inflammation of the body in general, you have a fever. So there are some diseases that manifest themselves as inflammation. They are not infectious. So we have many of them like that. And for the sake of time, we'll not talk about them in details. Yes, but they have diseases like that. And so it's good to check yourself when you have a fever that is seeming not to stop when you take anti-malaria or antibiotics. What cause of fever is fever because of dehydration or because of circumstances. You could spend when you spend some time without drinking water, or you're exposed to strong radiations of sunlight, you can have a fever just because of that. Yeah, you are dehydrated, you have been exposed to heat, you can present with a fever. But fever, usually the fever is isolated, it's just fever. You just feel dry and feel feverish. You don't feel any other thing. Yeah. And so just by taking water, you find yourself back to normal temperature. The fifth reason why people can have a fever is because of exposure to a toxic substance. Yeah, people into farming, fertilizers, and all of these things. You can be exposed to something like that, or you can even take a normal drug for another disease, like antihypertensive agents and agents against convulsions. When you take those drugs, sometimes one of the adverse reactions is that you are going to present with a fever. And you're wondering where the fever is coming from. You take another drug to calm down the fever, you take an anti-inflammatory, but when you're taking the drug again, you still present with the fever. So you need to know these are little things you need to be aware of about fever. Yeah. If you really like our content, please like the button down, like it, like, and then subscribe to our channel. It's going to really help us to attract more people and for it to be easily be shared on the algorithms on YouTube. You to comment, tell us what you want to know about fever. This is just an introduction to a video on fever. We would like to talk more about it. Tell us in the comments what you want us to say about fever. And above all, share to people, share to different platforms, WhatsApp and stuff. And we are going to be happy to have you. So, just to note again before I go, that when you present with fever, try to characterize your fever and try to check for symptoms associated. And above all, consult a health personnel and ask for help. Thank you very much.